Welcome to the seminar on the legal foundations of semiology in medicine. In this comprehensive exploration, we will delve into the intricate legal framework that underlies the practice of semiology and its implications for medical professionals. Through an in-depth analysis of various topics, we will navigate through the legal principles, ethical considerations, and responsibilities that guide the application of semiology in patient care. The legal foundations of semiology in medicine are the basis for accurately interpreting and communicating diagnostic findings, adhering to ethical standards, and obtaining informed consent. Understanding these principles is crucial for effective healthcare practice while respecting patients' rights and legal obligations. The principle of consent is crucial in semiological examinations. Informed consent requires comprehensive understanding, and patients must possess decision-making capacity. If unable, a surrogate or guardian can give consent. Patients also have the right to refuse or withdraw consent while being well informed of the consequences. Upholding these ethical and legal principles is essential for respectful patient-doctor relationships. Patient confidentiality and privacy are protected rights in medical practice. Professionals must safeguard patient information through security measures, seek patient consent to disclose findings to others, and follow legal and ethical guidelines to maintain trust and facilitate accurate diagnosis and treatment. To provide effective clinical care, accurate and reliable diagnostic procedures are necessary in semiology. However, medical professionals must also consider the legal implications associated with these procedures, including issues of accuracy, potential harm, and legal obligations. It is crucial to select scientifically validated tests, assess the risks and benefits, obtain informed consent when necessary, and adhere to legal requirements for ordering and interpreting diagnostic tests. Integrating these legal considerations into the decision-making process ensures safe, accurate, and legally compliant semiological assessments. It is important for medical professionals to effectively communicate semiological findings to patients to ensure their understanding, promote informed decision-making, and support collaborative care. However, there are legal challenges and responsibilities that must be considered in this process. Firstly, medical professionals must provide patients with all relevant information about their semiological findings. This requires clear explanations, avoiding technical language, and ensuring that patients fully grasp the implications. Failure to communicate effectively can result in misunderstandings, noncompliance, or legal disputes. Secondly, accurate documentation of communicated findings is crucial. This helps establish a clear record of communication between healthcare providers, minimizing potential miscommunications or legal conflicts. Furthermore, medical professionals need to navigate ethical and legal constraints regarding the disclosure of sensitive information, such as genetic or psychiatric findings. There may be instances where practitioners have a duty to warn third parties of potential harm, requiring them to balance legal obligations with patient confidentiality and privacy. By understanding and addressing these legal challenges, medical professionals can ensure that patients receive comprehensive information in a manner that respects their autonomy, builds trust, and reduces legal risks. In the section on legal and ethical issues in telemedicine, we explore the considerations involved in conducting remote semiological assessments. Topics include licensure, jurisdictional constraints, patient privacy and data security, as well as ethical concerns related to therapeutic relationships. In the video on legal aspects of semiology, we will explore the importance of interprofessional collaboration in semiological evaluations. We will discuss the legal obligations of healthcare professionals, such as role delineation, information sharing, and documentation. These considerations are crucial for effective teamwork and mitigating legal disputes. In this section, we will explore the legal responsibilities and liabilities of medical practitioners in the context of semiology. Accurate interpretation and communication of findings are essential to fulfill our duty of care, avoid negligence allegations, and ensure optimal patient outcomes while adhering to legal and ethical standards. In summary, accurate and comprehensive documentation of semiological assessments is crucial for medical professionals. They must comply with legal requirements and exercise care when making changes to medical records to avoid legal disputes. Adhering to these guidelines ensures the integrity and accessibility of semiological assessments and minimizes legal risks. Conducting semiological assessments in pediatric patients presents unique legal challenges regarding informed consent, privacy, parental responsibilities, and potential cases of child abuse or neglect. Medical professionals must navigate these complexities to provide accurate and ethically sound care. Cross-cultural semiology poses legal challenges in areas such as effective communication, cultural differences in symptom perception, and diverse legal and ethical obligations. Medical professionals must respond with cultural sensitivity, utilizing qualified interpreters and respecting cultural beliefs and practices. Seeking guidance from local experts is encouraged. In the video on legal aspects of semiology, we will explore the legal implications of using emerging technologies, such as artificial intelligence and genetic testing, in medical assessments. This includes understanding the legal validity, ethical considerations, and regulatory frameworks surrounding these technologies. We will discuss the specific requirements and potential liability associated with using AI systems in medical decision-making. Additionally, we will delve into the legal obligations surrounding genetic testing, including the communication of results, informed consent, and data protection. It is important for healthcare professionals to stay informed about local regulations and ensure compliance with applicable laws and professional guidelines. Through this understanding, we can navigate the legal landscape and use these technologies ethically and responsibly. In conclusion, the legal foundations of semiology in medicine play a vital role in guiding the practice of medical professionals. Throughout this seminar, we have explored a range of topics,